Hello, Mrs. Annie. Hi, Amy.
Hi, Dr. Eva. I'm here because of my mom. She's been experiencing some diabetic symptoms lately, so I brought her here to be examined.
Really? Okay. Let me examine her to be certain. I'm sorry, Mrs. Annie, but the signs on your skin indicate diabetes. But why does diabetes affect the skin too? High blood sugar levels damage blood vessels by causing poor circulation and slow wound healing. This leads to dry, itchy skin and improper wound recovery. Wow! Diabetes also makes people more prone to infections, worsening skin issues like boils and staph infections. So, Dr. Eva, as a diabetic, what skin signs should I watch out for? That's a good question. Today, you'll learn about the 7 surprising skin signs of diabetes you need to know. From itchy skin to diabetic blisters, I'll describe these signs so you can easily identify them quickly.
Interesting. Please proceed, doctor.
I'll also explain how these signs are linked to diabetes. So, listen attentively until the end of this video to arm yourself with the knowledge you need to fight diabetes early. We're all ears, Dr. Eva. Mrs. Annie, have you been experiencing itchy skin? Yes, I have. Well, itchy skin is a common symptom of diabetes, where the skin feels itchy all over or in a specific area. Scratching can cause the skin to thicken and become leathery over time. This makes it harder to resist scratching, leading to potential skin splitting or tearing, which can result in infection. Wow! But what causes the itching in the first place? Itchy skin is caused by high blood sugar levels, damaging the nerves that control the skin, leading to dryness and itchiness. High blood sugar can also trigger diabetic neuropathy, which includes symptoms like numbness, pain, and itching. Is this sufficient to detect diabetes through skin signs? No, Mrs. Annie, it's not. However, pairing it with other signs like digital sclerosis can help you to be more certain. What is digital sclerosis? Digital sclerosis is a symptom common in type 1 diabetic patients. It's a diabetes symptom that causes the skin on the fingers and toes to become hard, waxy, and thickened. The skin can also become dry, cracked, and swollen. It may appear like the fingers and toes have been dipped in candle wax, and the nails may become hard and thick. Wow! Is digital sclerosis also caused by high blood sugar levels? Yes, it is caused by high blood sugar levels and poor blood circulation. It can equally be a sign of nerve damage or neuropathy. Digital sclerosis can lead to difficulty with fine motor skills like picking up small objects, buttoning a shirt, or tying shoelaces.
Is there a solution for digital sclerosis, doctor?
Yes. However, controlling your blood sugar levels is the most effective treatment and symptoms may improve. Have you noticed yellowish patches on your eyelids? It could be xanthelasma. Come on, doctor. Xanthelasma? Can you explain in simpler terms? Of course, Mrs. Annie. I'll explain it better. Xanthelasma, also known as xanthomatosis, is a rare condition often seen in people with diabetes. It appears as yellowish, fatty deposits on the eyelids. Though not painful, the skin around those deposits may be red or inflamed. Xanthelasma can also occur on other parts of the body, like the neck, chest, or groin. But why do diabetic patients get xanthelasma? It's because diabetic patients often have high levels of triglycerides and LDL cholesterol, known as bad cholesterol. This can lead to cholesterol-rich deposits in the skin, causing xanthelasma. It's more common in type 2 diabetes than in type 1.
Dr. Eva, I heard that people with diabetes are prone to infections. Is that true?
Yes, it is, especially bacterial infections. High blood sugar levels create an environment in the body favorable for bacteria growth. This happens because high blood sugar produces more harmful chemicals called free radicals, weakening the immune system and natural defenses against bacteria, like white blood cells and antibodies. That's bad. So, what are the symptoms of these bacterial infections? Staphylococcus, or staph, is one of the most common bacterial infections in diabetic patients. It can cause various skin infections such as styes, folliculitis, or paronychia. Symptoms include redness, swelling, and pain in the affected area. Incredible! I can't believe a single bacteria can cause so many skin problems. Yes, Mrs. Annie. As if it wasn't enough, diabetes patients also suffer from fungal infections.
Interesting. Please tell us more.
Just like bacteria, certain types of fungi, such as Candida albicans, thrive in moist, warm areas of the skin. They can cause conditions like athlete's foot, jock itch, and ringworm. These infections typically result in red, itchy rashes with blisters and scales. They spread easily and can be challenging to treat. Now I know why I've been suffering from constant infections.
Sorry, Mom. We're at the hospital now, so you don't have to worry anymore.
I promise you'll get better. Thanks, my sweet child. Mrs. Annie, the signs on your neck indicate acanthosis nigricans. Wait, what's that? Acanthosis nigricans is a skin condition that causes the skin to become dark, thick, and velvety. It may feel rough and leathery and can be raised with a different texture than the surrounding skin. This condition commonly affects the neck, underarms, groin, hands, and feet.
Why is acanthosis nigricans a sign of diabetes?
Well, acanthosis nigricans is often a sign of insulin resistance, which is an indicator of type 2 diabetes. High insulin levels can lead to increased production of insulin-like growth factor 1, or IGF-1, causing rapid cell growth and thickened skin patches. Suffering from insulin resistance is more critical than I thought. Can I see your hands? Yes, doctor. These aren't ordinary blisters, Annie. They're diabetic blisters.
Really?
Yes. Diabetic blisters, also known as diabetic bully, are fluid-filled blisters that can appear on the skin of people with diabetes. They are typically clear or red and can vary in size. These blisters are usually painless and may occur on any part of the body, but they're most common on the hands, feet, legs, and forearms. Sometimes they can burst, leaving behind open sores that may become infected. But how are these blisters related to diabetes? Diabetic blisters are linked to nerve and blood vessel damage from high blood sugar levels. This damage can cause fluid leakage from blood vessels, leading to blister formation. Diabetes can equally impair nerve function, reducing sensation and making it hard to notice blisters before they become infected. Diabetic patients are also more prone to bacterial and fungal infections, which can worsen blister development.
That's serious!
Yes, it is. Now, that's all I have for you about the 7 surprising skin signs of diabetes you need to know.
Thank you so much, Dr. Eva.
On behalf of myself and my mom, we really appreciate you taking the time to explain these surprising skin signs. Thanks a bunch, Doctor. Those signs are indeed surprising. You're both welcome, and the pleasure is all mine. Mrs. Annie, before you go, I'd like to collect some blood samples from you for lab testing. Okay, no problem. Let's get started.